This is the weekly Health Law News Nugget from Southern Health Lawyers. I'm Rich Sanders.
And this is the Health Law News Nugget for the week of March 11, 2019. Well, two big developments in the last week, both concerning Medicare policy and federal issues that have been long discussed in the past couple of years in terms of reforming federal health care policy that affects the entire industry. First, Seema Verma, the administrator of CMS, in a presentation to a hospital association last week, mentioned that the CMS folks or policymakers are working on revisions to the stark rules and regulations that affect virtually everyone in the healthcare industry that associates with physicians or is physician-based. This is really significant because the last major review of those rules was over 10 years ago. Ms. Verma mentioned that the nature of the changes to the rules would include value-based purchasing, electronic medical records interoperability, and probably something related to clinical integration like we've seen in the managed care contracting entity domain in the last 5 years. But it's exciting news for those of us who work with physicians day in and day out and struggling to make sure that those stark rules are complied with because they are complex and, as Ms. Verma noted, need to be updated. The other significant development from Washington relating to CMS was March 6th. CMS issued a proposed request for commentary on the proposed sale of health insurance across state lines. Now, this is something that's been discussed at an academic level or a think tank level for many years, starting, frankly, with the healthcare reform movement in 2009. But through various fits and starts, no serious proposal has made it to the floor of Congress, which will allow for the sale of health insurance from one state to another. As so many of you know who watch the News Nugget and are dealing with the business of health insurance, every single one of the 50 states has its own health insurance regulatory scheme, and each state, even the national players, even the large national health insurance companies, have to deal with 50 different health insurance companies or health insurance commissioners and 50 different regulatory schemes. So to have interstate sale is supposedly, according to the proponents, going to decrease cost, increase competition, and ultimately be better for those who purchase insurance policies. Only time will tell, but it'll be interesting to see what the comments look like to CMS in response to this request last week. As always, there's exciting developments in Washington that affect all of us around the country. Please stay tuned to the Health Law News Nugget next week, and thanks for joining us today. Bye-bye.